How do UL-listed healthcare-grade patient entertainment devices protect your patient safety and improve the experience? Let's listen to Glen Rocco at PDI tell us more, and we'll share a free infographic download for you.
Healthcare grade means a lot of different things to a lot of different people. Whether I'll do a quick question out there. Some of us, when we were younger, maybe much younger, ever take a 9-volt battery and just have to see what it does and stick it to your tongue, you get shocked. You get a little sting, get a little shock. If we take our finger and touch it across those same two terminals on that battery, you don't get shocked. The method behind that is our skin offers us a certain level of protection, a certain level of resistance to that shock potential. In the consumer market, that's great. Most of us don't go around with IVs or pumps or anything into our bloodstream in a home market. But when you get in healthcare, often that skin barrier is broken. It's got an IV in it, or it's got other devices into your skin. So the healthcare standard is much more stringent than a consumer standard is. For example, the consumer market can have up to 3,500 microamps of leakage current that's acceptable on a television, a radio, a handheld device that you may hold at home. But in the healthcare market, if you can touch it, it has to be less than 100 microamps. So 35 times greater protection for leakage current is required within the healthcare facility on an electrical device. Also, all plastics have some degree of petroleum in it when it's made. In the healthcare industry, it has to be made with V0 plastic, meaning that the product can be ignited with a flame, but if that flame is removed, it must self-extinguish. We all know that if you catch plastic on fire, it gives off some very noxious black smoke, and it can quickly cause a facility to have to be evacuated. So at any time it's lit or ignited, when you remove the flame, it must self-extinguish. That's another requirement for healthcare. It has to safely survive a drop of a 1-pound ball from 3 feet. So a steel ball is dropped on the device from 3 feet. It can crack, it can break. These things are glass, they're allowed to break. What you can't then do is touch any high voltage or voltage that can provide a shock to the patient. So another degree of double insulation or security there, multiple grounding. We choose to make all of our televisions out of antimicrobial plastic for the cleanliness, the disinfection. Most of the times antimicrobial plastics are not used on a consumer grade product in the home environment unless it's something that's in the bath or in the kitchen. You're looking at a television, for example, they don't use the V0 plastic, they don't use antimicrobial plastic, they don't have a double insulated or grounded plug. Internally, all the devices, all the electrical components are at a higher standard, typically because of the time that they're on. In a residential television set, it's typically on less than 6 hours a day. In a healthcare environment, our testing shows that it's 18 hours a day. It's a great distraction to the patients. The nurses love it. They leave it on almost all the time. With that longevity or time on comes heat. Heat is the killer or the bane of all electrical components. So we dissipate the heat better than in a consumer grade set, while at the same time having to make sure that it can be clean, wiped, and disinfected with either a spray bottle or a wet disinfectant rag. We operate our televisions at a lower temperature than a consumer grade product. Typically a consumer grade product has a operating temperature around 60 degrees Celsius. We operate down in the 25 degrees Celsius range. AC grounded plug, I mentioned that. There is a healthcare grounding plug. If anybody's seen a receptacle with a green dot in your facilities, those are guaranteed grounded, not just a neutral ground, but a dedicated ground. And the plugs on a UL listed healthcare device must also mate to that. If you purchased a consumer grade product recently, you'll notice one of the plugs is larger and one smaller. That's because they're using the neutral line as a ground, and it can be broken. A dedicated ground is much less likely to be broken. All of the cooling holes in the television designed for healthcare by PDI are angled and ported in a direction where liquid sprayed on it will not ingress or come inside of the television, so you can easily spray it down with a bottle and wipe it clean. Twice the impact standards of a consumer grade set as well. I mentioned the 1-pound ball. Some of the other advantages, nurse call, pillow speaker connectivity. You've got television all the way across the room. You've got to somehow control it. IR remote controls get lost, they walk, they get wrapped up in the bed sheets and end up down in housekeeping. Encryption technology to stream high definition video throughout a healthcare facility, and the Motion Picture Association demands that their content not be able to be stolen or copyrighted. We have cloning capabilities for ease of setup within the facility. And your facility administrators can plug in cloning devices in multiple locations and easily set up the sets. Infection control, consumer grade TVs do not have any infection control. Again, we use antimicrobial plastics and antimicrobial keypads to reduce the HACs within the facility. I already mentioned the pillow speakers. Multiple televisions in one room. Obviously, have to have different IR commands or codes. Or my remote's going to control your TV, and your remote's going to control someone else's TV. They go on a 4-channel ABCD type bed situation, so that you don't have crosstalk from one unit to the other.
Please visit our website to download our infographic that captures this information for you to share with others. Thanks for listening.